Hi, I'm Rosie. I'm a clinical psychologist and founder of the Birth Healing Collective. And I'm here today to talk to you about how to support breastfeeding after a difficult or traumatic birth experience. I think that both physically and emotionally, the first few weeks of breastfeeding are usually pretty overwhelming. And that goes to say even after a straightforward birth experience. Usually there are challenges in terms of latching and tongue ties and getting the position right and getting your supply started, even when birth has been relatively straightforward, which it rarely is, right? But if you are starting your breastfeeding journey after a difficult or distressing, complicated birth experience, then there are a few things that go on that can make it actually harder to get that nice breastfeeding relationship started. And for something that is so natural and seemingly so simple, breastfeeding relies on a really complex physiology between mother and baby. So after a difficult birth experience, this can all be much more complicated. So let's talk today about why and what you can do about it. So in terms of going through a difficult birth, it can affect breastfeeding in a few different ways. Firstly, your body and your physical recovery. You may have gone through some really difficult physical things in the course of your late pregnancy, birth, and postnatally. So these things like experiencing a hemorrhage or an infection or a birth injury or major surgery, right? All of these things put additional stress on your body at a time when ideally it would be transitioning from having just given birth into starting to produce milk. So any additional stress on your body physically during this time can kind of interrupt the hormonal flow that we would like to be able to see there. And it can make it more difficult for your body to start to be producing milk. So there's also the emotional side of this, okay? Because we know that our emotions and mood and hormones are all very intertwined. And so if our body is under a lot of emotional stress as well, which through no fault of your own, a traumatic or difficult birth experience could have left you with, that might also be something that can stick around and leave you feeling in a very heightened state after birth, which can interrupt and disrupt those hormones from flowing in the way that you'd like them to. The other major thing that I see all the time with the families that I work with is any kind of separation between you and your baby, which again, sometimes is absolutely medically necessary because of the birth and the way that things went. Either you or your baby may have required some extra care in intensive care or the NICU or just kind of specialist attention. For hours or potentially days, you may have been separated. And this is a really difficult part emotionally for most parents, but also it can be one of those factors that just makes it that little bit harder for the breastfeeding to get started and get off on the right foot. So most of the mums that I work with want to be able to breastfeed, and it's not for everybody, but I think that most of the parents that I see are hoping to be able to provide the nutritional benefits for their baby, but also so that they themselves can have that bonding experience and give that with their baby as well. So if breastfeeding is important to you, let's go through some of the ways that you might be able to overcome some of these initial hurdles that you're dealing with. Firstly, I would say the number one thing I want to start with is just be gentle with yourself. Knowing that you might be facing some of these additional challenges as you start your breastfeeding journey because of the birth and the way that things went and what happened to you. I hope that just knowing that this is a more challenging experience for you could actually help you to be a bit more gentle with yourself, a bit softer and a bit kinder. If you find yourself feeling stressed or anxious, or if you're blaming yourself for it being hard or feeling like a failure because breastfeeding isn't happening, please know it is not your fault. This is really complicated, and if it feels hard, it's because it is hard. As I said before, breastfeeding is incredibly complicated for something that is so natural, and it's often really tricky to get started. So treat yourself gently. Try to show yourself the same kindness that you would show your very best friend if they had just been through what you've been through and were in your shoes right now. Responding to your feelings in this way, with self-compassion, can actually reduce some of the stress that's in your body, which could make the breastfeeding itself easier. So there are lots of reasons to be gentle and kind to yourself at this time. The second thing I'd like to suggest is that you really focus your time now on rest and snuggling your baby. Because when you and your baby are reunited or beginning to get to know each other after a difficult birth experience, it's so important to prioritize that skin to skin and rest. Even if quite a few days have passed since the birth, your body will respond hormonally to just being able to hunker down with your baby and cuddle them. So the additional rest and really taking kind of any additional physical burden off you can help your milk supply to come in, as well as kind of help the stress response that's happening in your body. And being able to cuddle up and do that skin to skin with your baby will help your hormones respond. Frequent feeds, lots of rest, and a lot of like really good nutrition. Don't neglect your own nutrition and your own hydration during this time. If you have older children, invite them to snuggle in with you. Watch lots of movies and TV, read books, just rest and snuggle together. This won't be forever, but it means that you can actually just focus on that and let your body get what it needs. Let it heal from the birth and give it a chance to begin to start to make this milk for you and your baby. Now, this usually means that we have to get good at asking for help, even if this feels really uncomfortable. So if you're going to do this kind of snuggling and resting and really supporting your body during this time, it means leaning on your support network and inviting in your partner, your friends, your family to do as much as they can for you. They could be changing nappies, they could be sterilizing and washing your breast pump, they could take your toddler to the park, people can provide meals. Now, asking for help and receiving help can feel really hard, especially if you might actually feel like, I could do these things. I am kind of physically well enough to do these things. But this is about giving your body what it needs to be able to recover from the birth experience you've just had and be able to bring in the milk to feed your baby. Now, on top of all of these good things, you might also want to bring in some extra professional breastfeeding support. So there is a lot of conflicting advice out there, and a lot of the mums that I see will talk about how one midwife in the hospital said one thing and then they were told something else, and someone said nipple shields and someone said definitely don't use a nipple shield. So I sometimes think that finding your own professional who you can sort of really get to know and that you can trust them and they can get to know what's happening with you and your baby kind of up close, it can make a world of difference. And if anybody doesn't make you feel immediately supported, please know that you can just fire them, replace them. You don't have to continue with them. But if you do find somebody who can support you really well, a lactation consultant, for example, can provide you with really personalized advice on reducing pain, supporting a good latch, boosting your milk supply. And there are also, if that's difficult for you to organize, then there are free sources of support out there as well. Now, the other thing I did want to say in terms of getting free support or like extra support is that sometimes the advice that you might get from a lactation consultant could leave you feeling totally overwhelmed because sometimes the strategies are quite intensive. For example, if you've been advised to do something like triple feeding, even just for a period of time, triple feeding is when you feed the baby, express milk afterwards, and then top up the feed using a syringe or a spoon or a bottle to make sure that you are both extracting a certain amount of milk and that your baby's getting a certain amount of milk. That can be a very intensive cycle that doesn't leave much time for rest or sleep before you're supposed to wake up the baby and do the next feed again. So if the strategies that are recommended to you are intensive like that, honestly, it often comes down to the level of support that you have available as to whether you're even going to be able to do that and at what cost, in terms of your own sleep and kind of sanity. So this is where, you, in terms of professional support, you might want to hire a postpartum doula. That can be a really good option, or see if there's a family member who can come and stay with you for a period of time, just so that you can actually do all of this with the support of your partner. It's a lot, yeah? And it's okay if it just feels like too much. It often comes down to the level of support that you have around you to be able to implement these strategies, and whether that's something that's possible for you. I think the last thing that I wanted to say on this is just the importance of being both patient and persistent when it comes to breastfeeding, but also to know that it's okay to stop if you need to stop. Right? I think it does take a lot of work and persistence to get to that place where breastfeeding feels both manageable and potentially even enjoyable. But if you are struggling and either you're not getting the support and you don't have the support around you to be able to do the things I've just suggested, or you're doing all of those things and it just isn't clicking, then you may need to weigh up the benefits of pushing on with it versus giving yourself permission to let it go. Sometimes letting it go is the right thing for you and therefore your baby. And you need to remember that your baby's needs are still being met if they are being given formula or other sources of milk. For some mums, this decision can involve some big feelings of sadness and potentially grief about the missed out on experience of breastfeeding that you may have anticipated and looked forward to and really wanted. And that's okay, and we need to make room for those feelings. But it can also bring a huge sense of relief, and sometimes just open up the opportunity for you to be able to move forward into the next phase of motherhood, feeling lighter and actually opening up some emotional space for you to be able to enjoy that. Now, if you are finding that your birth experience has stayed with you in unhelpful ways since the birth, so sometimes we can be left with a lot of really difficult feelings about the birth. Sometimes there are memories about the birth that keep popping up that are causing distress. Sometimes it might just have left you feeling really low and down or really anxious. I would always recommend seeking some professional help with that earlier rather than later. Usually this whole experience of going straight from the birth into feeding and sleep and all of that kind of adjusting your whole life to a newborn means that parents don't seek support early enough. So I always would recommend, if you feel like this is harder than it should be and harder than you expected. On one level, I want to say to you that is completely normal. Nobody is emotionally prepared for this, and it is insanely hard. And at the same time, if you're finding that you're kind of really struggling to have periods of enjoying it and happiness, and it's being affected by these persistent feelings of feeling low or anxious, then please know that there is support available, and it can make a big difference to have that support during these early months of kind of getting to know your baby and getting to adjust your life to being a parent. So seek out some additional support from counsellor, perinatal psychologist. There is support out there, and it's a really important time for your mental health and your well-being. So think of that as something that you're doing for your baby as well as for yourself. So in summary, I think establishing a good, successful, enjoyable breastfeeding relationship does require a combination of factors. There's definitely some luck in there because there are some factors that are outside of our control. But it also requires some patience, some persistence, being really gentle with yourself, and bringing in a lot of support, both in terms of breastfeeding, but also in terms of your life and all the other elements of being a parent, so that you can just, for this little period of time, focus just on resting, recovering, healing, supporting your hormones and supporting your milk production. I'll link to some further resources underneath this video, but if you have any further questions, feel free to reach out to me at the Birth Healing Collective, where I provide a range of programs, resources, and classes for any parent who has been through a difficult birth experience. Until next time, take care.